I'm an ophthalmologist, and that means I deal with many different problems relating to the eyes. One of the most common problems we face, particularly in older patients, is cataracts. A cataract forms when the natural lens of the eye goes cloudy. This normally occurs as a result of gradual aging, but it can occur much earlier in some patients, particularly if they're diabetic or if they've used steroid tablets. I consult twice a week, and most of my patients are able to see me for their first consultation within a week to 10 days. When I first see a patient, I ask them what sort of problems they experience. For example, problems with driving, problems with reading, or problems with hobbies or sports that they enjoy. I would then proceed to examine their eyes in detail, firstly to determine whether or not their cataracts are significant, and also to make sure that there isn't any other problem in their eyes which is also affecting their vision. In order to examine the patient, we'd ask them to come and sit in a chair like this one, and I would examine them with a piece of equipment like this, which is referred to as a slit lamp. This is like a microscope, and I can examine the patient's eyes in detail through the eyepieces here. When I'm looking at that patient, I can look first at the front of their eyes, and then I would need to put drops in their eyes in order to make their pupil, the black part of the eye, larger. I would then look into the back of the patient's eye, using again the slit lamp, but also using a lens of this sort, which enables me to focus on the cataract and on the retina, the photographic film in the back of the patient's eye. Having established that a patient has a significant cataract, I would then ask them whether they would like to proceed with surgery. In most patients, the likelihood of an improvement in vision following surgery is in the order of 95%. We then need to measure their eye in preparation for the operation. When we remove the cataract, we have to replace it with a tiny intraocular lens, a plastic implant, which the patient will then have within their eye for the rest of their life. Most of my patients are able to have surgery within a week or two of the first consultation.